Good day everyone! We are the Group 6 and we'll be discussing about the Pneumocystis pneumonia. Pneumocystis pneumonia or PCP is a serious infection that causes inflammation and fluid buildup in your lungs. It is brought on by a fungus called Pneumocystis hiruvetschi that spreads through the air. This fungus is very common. Pneumocystis pneumonia does usually infect people with healthy immune systems. However, people with weaker immune systems, such as those who have cancer, HIV, infections, or AIDS, are more vulnerable to this infection. Pneumocystis specimens are commonly found in the lungs of healthy people, although it is usually not a cause for disease. However, they are a source of opportunistic infection and can cause lung infections in people with a weak immune system or other predisposing health conditions. PCP is seen in people with HIV or AIDS, who account for 30 or 40% of PCP cases, those using medications that suppress the immune system, and people with cancer, autoimmune or inflammatory condition, and chronic lung diseases. Early in the infection, you might not have symptoms or they could be mild. They may include fever, cough, difficulty of breathing, chest pains, chills, and fatigue or tiredness. Symptoms usually comes on slowly, over several weeks, in people who have HIV. In those whose immune systems are weak, for another reason, they tend to start over a few days. So, for the risk in prevention, Pneumocystis pneumonia is extremely rare to the healthy people. This kind of disease can live in the person's lungs without causing any kind of symptoms. Most common people who have the PCP are the ones that have weakened immune systems that their body can fight the infections well. So second, to prevent of having a PCP is taking a medicine that is only prescribed by the healthcare providers. This will help to lessen the development of the disease on the person's body. The trimethoprim or the sulfamethoxazole is the most common prescribed medication to prevent PCP. Thus, there is no vaccine in this kind of disease. Sources: PCP can be spread through the air. Only those people who have higher immune systems are the ones that can carry this kind of disease without having any kind of symptoms. This disease can be spread from person to person that may affect the health of people who have weakened immune system. Diagnostic testing and treatment. It can be diagnosed by using a sample from the patient's lungs. Sputum is the one that they collected to do the procedure, bronchoalveolar lavage, that is sent in the laboratory and examined with the use of microscope. Prescribed medication might treat the PCP. Trimethoprim or sulfamethoxazole is the most common prescribed medication. It takes for about 3 weeks. TMP or SMX can cause side effects such as rash and fever. That would be all for our report. Thank you so much for listening.